It's recording.
Good afternoon and welcome to the League of Women Voters of Manatee County Reproductive Rights Action Team meeting. This is November 17th, 2025. My name is Nancy Hughes and I'm the chair of the action team. This program is being recorded and will be available on the League of Women Voters YouTube channel. Any public showing of this video, other than its entirety, needs to be given written permission by the League of Women Voters of Manatee County. For those who are new to this group, the League of Women Voters is a nonpartisan grassroots organization that works to protect and expand voting rights and to ensure that everybody is represented in our democracy. We do not endorse candidates, but we do take positions on issues after careful study and the consensus of our members. One issue that the League has supported for a number of years is the right of women to make their own personal decisions about reproductive health care without the interference of politicians. Such decisions also need to be based on accurate and honest information, not coercion. Today, we're going to be discussing crisis pregnancy centers in Florida. They're commonly called CPCs. The state legislature appropriated approximately $30 million in 2025 to one specific nonprofit organization, the Florida Pregnancy Centers Network. This network contracts with approximately 50 organizations in the state to operate more than 100 CPCs. The primary goal of these centers, it's very simple: dissuade women from having an abortion. Unlike Planned Parenthood and legitimate medical clinics, Florida health authorities have been given virtually no power to regulate these crisis pregnancy centers. The contract is with the Florida Pregnancy Center Network, which outsources the operation, and this arrangement creates barriers about the public's ability to scrutinize how the taxpayer funds are being spent. Our speaker today is State Representative Kelly Skidmore, who introduced a bill, it's House Bill 6001, and this bill would defund the network and these centers. Kelly Skidmore is an accomplished leader with more than 15 years of experience heading organizations and helping them achieve their goals. Within that time, she has served as the Chief Executive Officer of the Palm Beach County Medical Society and the Vice President of Advocacy and Public Policy for the Florida chapter of the Arthritis Foundation, among other positions. Representative Skidmore is also a passionate public servant. Her many legislative achievements include the creation of a statewide database for pain medicine prescriptions. And in 2022, she was able to clarify in statute that public schools may provide menstrual products in the student bathrooms. In 2025, the legislature passed Representative Skidmore's landmark bill to increase research of sickle cell disease and expand the state's sickle cell disease registry. So thank you, Representative Skidmore, for joining us today. So why don't we begin with you explaining why people should be concerned about or what we should know about crisis pregnancy centers.
Well, thank you, Nancy, and thanks everyone for joining this afternoon. And thank you for everything that you do to help educate voters and raise awareness about the things that go on in Tallahassee. We sometimes think we're shouting from the rooftops, but it's really helpful when you all share some of the information. So House Bill 6001 is language that I actually filed last year when the Speaker Danny Perez, gave every House member kind of a free bill slot to file a repealer bill. And I could think of no better section of law to repeal than the crisis pregnancy centers. And back in 2006, I was elected the first time. And that's when Jeb Bush, in that term, I served from 2006 to 2010. Jeb Bush gave the first appropriation to this network. It was $2 million, and I fought tooth and nail against it then. And I've been fighting ever since to eliminate taxpayer dollars going to this, in my opinion, fraudulent organization. So I took the opportunity with this repealer bill to repeal the entire statute. Last year, I also had another bill that forced some guidelines around the transparency and accountability of the organizations that are part of the network. But I don't think that that is really what needs to happen because I don't trust the network and I don't trust the organizations, to be honest and truthful. I really believe firmly that we need to stop funding them with taxpayer dollars. And if there is enough of a support system out in Florida for them to raise their own money, then that's what they should go do. But it should not be my money or your money that pays for what they do, which none of it is actual medical care. They do not provide actual medical care, and they really lure women in who might be in a crisis pregnancy or might have been when abortion was actually available in Florida and you had, options and choices with your pregnancy. But this is something that is in this environment that we're in right now. There aren't any crisis pregnancies. Most women don't even know they're pregnant when they would be considering what their options are. So there's no reason why we should be spending, it's $29.5 million that is recurring. They don't even have to ask for it. It's just written into the state budget. And I just really feel strongly that that is not an appropriate use of taxpayer dollars.
You use some very strong words, fraudulent, don't trust. Can you give us some specific examples for people who aren't familiar with CPCs?
Well, most of us have probably seen the billboards. That
So the
was
money
something
goes for
that
advertising.
the billboards that advertise pregnant and alone, question mark, need help, question mark, call us. We're here for you. We'll help you. It leads women to believe that they are actually a support network and that they give you the resources of all the options that are available. It started as a network of 50 Baptist churches. And I have nothing against religious Baptist churches, but they are not equipped to give women advice on pregnancies. And that is not something that the taxpayers should be supporting. So it is a phone network. It started out that way. That's all it was. There are now centers where women can go in. They are given bad information. They are given not medically accurate information, information that suggests abortions cause cancer, information that suggests abortions will make you infertile, information that is not HIPAA protected when you give information back about your own self because they are not a medical provider. They give inaccurate information. They will lie to women about how far along their pregnancy might be. And they recently received advice from their legal counsel, national legal counsel, because these centers are in many other states, not to conduct a an exam of a woman suspected of having an ectopic pregnancy, because that is too much of a risk for the organization legally and with the individual. So, an ectopic pregnancy, as many of you may know, is a very serious uh, healthcare
Condition.
emergency,
Yeah.
right? Women need to know immediately if they have an ectopic pregnancy because they can hemorrhage and die if it's not taken care of. And so for these organizations now to take that advice to not let women know that they have an ectopic pregnancy is it's it's medical malpractice, but it's not even a medical provider that's doing the malpractice. So there are so many things that are wrong with these organizations. Again, as I mentioned, no HIPAA protections. If you're a 17-year-old girl, and you're in a small town and you go to one of these centers, which is where they typically are, they have no problem calling your parents and telling your mom or your dad, because they know who they are, that you're pregnant and you were seeking an abortion or you were seeking an alternative to continuing with the pregnancy, whatever, however they may phrase it. So they are not legit in any way. They are not trained. They have no medical education background. Um, and it's just really an unfortunate situation for women who are looking for legitimate care, whether that's because they want to keep their pregnancy or whether it's because they don't. But these fake clinics is what we always called them before they started changing their name to Pregnancy and Wellness. Um, we always called them the fake clinics. They do not provide medically accurate information, and they are a disservice to women around the country. So we certainly shouldn't be funding them with taxpayer dollars in Florida.
Well, what are you trying to correct with your legislation? As I understand it, it's pretty straightforward. It's very simple legislation. Could you
I want to
explain?
eliminate the funding. I
Fair
want to
enough.
eliminate the taxpayer funding. That's it. We are striking it from the statute. These organizations can exist, but they don't exist as a taxpayer funded network that is sanctioned by the state of Florida.
Do,
So we would repeal the entire statute that creates them.
do we know how many people would be affected if the money goes away?
Well, I'll tell you, if we had $30 million to do breast and cervical cancer screening, we could impact a whole lot of women with real medical care, with real prevention.
Mhm.
I don't know how many individuals seek out quote unquote advice from the CPCs throughout annually or throughout their existence over the last 20 some years, 20 about, well, they've been around, but we've been paying for them for about 20 years.
Hmm.
Um, so um, the reality is that it's not real medical care. It's not taking the funding away and eliminating the pregnancy centers does not take away the opportunity for women and girls to get medical care from a proper provider.
Mhm.
Those providers are still available. It just prevents them from being duped by these fake clinics.
Well, I was looking at the statute that covers CPCs, and it makes it sound as if the centers do a lot of the same or provide a lot of the same family planning services that one could receive through our county health offices, which are, of course, run by the Florida Department of Health. For example, both the CPCs under the statute and county health centers are charged with helping clients create individual reproductive life plans, providing no-cost pregnancy and STI testing, and making medical referrals because, as you say, these clinics do not have medical providers there, so all they can do is send a patient, a client, to a real provider. Couldn't we also make the argument that the legislators should redirect the CPC funds to the county health department since they're already doing it and there's a county health department in every single county?
We certainly could. And just for everyone's information, that family planning does not include birth control at all. So that is not giving a person, a woman who is seeking all of her options as the Department of Health would, the County Department of Health. So yeah, that's $30 million almost spread around 67 counties. Um, and you would be getting information from a true medical director. There's a doctor who runs each county medical office. So it's really about treating women with dignity and equity and truthfulness, honesty, which they are not getting at these clinics. They are being preached to. There is a tremendous amount of religious information and religious uh, artifacts inside the lobbies. It is very religious forward. It's intended to make women feel guilty about their decisions. And it's just wrong. Every part of it for me is just wrong. If we want to make sure that women are getting good care and referrals, you know, you want an impartial person helping you with those referrals. What if you really are at risk and need an OBGYN who is not opposed to uh, giving you care that includes a DNC or something that other folks might consider to be an abortion, right? Because no one believes that abortion is health care up here in Tallahassee, or not enough of us do. But abortion is not just about um, an unwanted pregnancy. Abortion is health care, and it is often necessary and needed for the woman's life, for, her health. It is something that every woman should be given the option to have that information. And I cringe at the thought of how many hundreds of women have gone through these clinics and been made to feel less than because they wanted something different than what was being preached to them. And that's on our dime. We're paying for that. And it really just galls me that my taxes go to that. And I really just want women to be redirected to medically accurate, impartial, unbiased information
So
about their health care.
what is the status of HB 6001?
It has been filed. Has not been, I didn't look today, but we're waiting for its committees of reference. So there is a Senate companion. It's just like every bill that you guys probably know how a bill becomes a law. So it's filed in both chambers. It will get its committee references, and then we will begin advocating for a hearing. The Senate sponsor is Senator Kristen Arrington from Central Florida, and a former House member who was in my incoming class with me, and someone who is a fierce advocate and fighter for women's reproductive rights. So we are really hoping to elevate the messaging, get the word out. Uh, you know, there's an interesting twist to some of what's happening in that Governor DeSantis uh, creates what we call a recommended budget and gives it to the legislature. It's the legislature's duty, responsibility, and obligation to write the budget and pass it and send it to the governor, who has line item veto authority. In other words, he can veto an entire line. He can't reduce a dollar amount. He can't say, well, I'm not going to, eliminate the whole appropriation, but I'll reduce it. He cannot do that. He can either accept the appropriation or line item veto it. In his recommended budget for 2025, he eliminated the funding for the Crisis Pregnancy Centers network. Now, I don't want to know what his ulterior motives were exactly, but that should give comfort to some of my conservative colleagues. And also, we are here in Tallahassee talking constantly about doging, Department of Government Efficiency, doging our cities, our counties. We are also supposed to be doing that, making that evaluation of our state agencies. And so the Department of Health could certainly make some recommendations where that almost $30 million could be spent. We can come up with our own ideas, as you mentioned, Nancy. But, the Department of Health should really have their finger on the pulse of what the needs are in our communities around the state.
Could you explain why we need to talk about this legislation now? There may be some people on this call who aren't familiar with the pre-session work that the committees are doing right now, and I believe it's through the middle of December.
Yes. So when we have session is a 60-day process. Sometimes it begins in March and sometimes it begins in January. And it is constitutionally set which years it will be March and which years it will be January. This year it's January. So we have what we call interim committee meetings that we hold in advance of that legislative 60-day session. We are in our fourth week of committee meetings. So we will have two more in December. And we meet in our committees, we hear legislation, we get presentations from agencies. Some are budget committees, some are hard policy committees. And we go through this process so that when we come on in January, first day of session is January 13th, that we will have bills that have been through the committee process and are ready for what we call the floor. And we will be able to take them up on the House floor and the Senate floor and pass them to each chamber and then send them off to the governor. Again, it's 60 days if we don't extend, if we get all of our work done. But we often have extended that period of time as well.
So how can we help you? How can we, as private citizens, do a better job of reaching our elected officials and having conversations with them, since this is a very difficult subject that's obviously been introduced, as you said, by yourself and others over the past several legislative sessions, and still is not moving forward. So what advice can you give us?
Whoever your state senator or state representative is, you should reach out to that person. You should also look at the committees that the bills have been referred to in both chambers, the House and the Senate. Let's assume that this is going to go to the House Healthcare Budget Subcommittee because it's a budget item. The chairperson and vice chairperson and all the members of that committee should be contacted. They should be asked to make sure that the bill gets a hearing. I think that it is important to make the case that this is $30 million of taxpayer money that is being inappropriately spent on fake information and should be redirected toward authentic, medically accurate healthcare. Whatever your message is, if you have a personal message that can really resonate with members, if you've had a personal experience with a clinic, or if you know of someone who has shared their story and is willing to let you tell that story about how this is not what we should be offering women in Florida as their health care. All of those are excellent ways of communicating. That can be by email, that can be by phone call, that can be by a letter, and that can be by a visit either in their district office or in the Capitol. So it's a tremendous amount of advocacy work that is necessary. But I have seen it work so often when there is a critical mass of people who force an issue to move forward. In fact, sometimes it's often the only thing that works when you've got sort of an obstinate legislature that doesn't want to do the right thing. So all of those things are very, very helpful. Also, letters to your local newspapers, op-eds, or newsletters, anywhere where you can share this bill and what it does and why we don't want the money being spent here any longer, and sort of just gaining that momentum by adding more and more people to the advocacy team.
Great. Lots to do, lots of great advice. Any final comment? Anything that we haven't touched on, either about crisis pregnancy centers or about your bill or about just the legislative process that this audience should know about?
Well, I think that there's a bigger story here, Nancy, that as I'm an older woman, I'm not in the position of needing an OB. But in the state of Florida, there are fewer and fewer and fewer doctors who are willing to be obstetricians. As you mentioned, I was the CEO of the Palm Beach County Medical Society, and we had an annual women's physician dinner. And we would go around the room. There was about 80 or 90 women doctors there, and a lot of them were OBGYNs. And last year, every single one of them was moving into just gynecology, because of the abortion laws, because of the threats and the risks to their practices, and because of the environment in the state of Florida. So here we are, my daughter's 31. She is not willing to live in Florida because access to a physician for her to grow her family is getting harder and harder and harder. And for those legislators who are still wanting to have families, or those legislators who have children who are wanting to have families, they need to understand the environment that's being created here, along with this false information that is being provided, is a negative environment for women, and is making it a landscape that is not conducive to families.
Very powerful message, Representative Skidmore. Thank you for
Thank
joining
you.
us. But before you go, I have one announcement for the audience. Um, if you're interested in helping to pass HB 6001, the League of Women Voters is hosting lobby days on January 20th and 21st in Tallahassee. So you can go up on the hill and put in a good word for HB 6001. In preparation for the legislature, the league's lobby days, they are holding boot camps. These are Zoom calls to prepare volunteers for effective and persuasive advocacy. And the first training, the first one, will be this Wednesday, November the 19th at noon. These Zoom sessions will cover issue briefings, messaging strategies, tips for productive meetings. So to register, just respond to the lobby days email that you should have received from the Florida League earlier this month. Or if you missed it, just let us know here at the League of Women Voters of Manatee County, and we can forward the information to you. So thank you again, Representative Skidmore, for your presentation. Thank you for your hard work, and thank you all for joining us today.
Thank you so much.